Hello everyone, in this video now I will be discussing about the group of drugs which are used in the treatment of gout or gouty arthritis. So now what exactly gout is? Remember, gout is a disease in which it is characterized by the elevated serum uric acid levels. So now where this particular uric acid is coming from? Remember, gout or gouty arthritis, it is a disorder of the purine metabolism. So now coming to the uric acid has a low water solubility. Because this particular uric acid has a low water solubility, it gets precipitated in the joints in the form of the crystals. Not only in the joints, it gets precipitated in the kidneys, subcutaneous tissue. So this uric acid gets precipitated in the form of the crystals in the kidneys as well as in the subcutaneous tissue. So now remember, we have another terminology which is secondary hyperuricemia. Now let me discuss what is secondary hyperuricemia. It results due to the excessive production of the uric acid or decreased excretion of the uric acid. So now in which all clinical conditions there will be increased production of the uric acid? Let's see. In the increased breakdown of proteins and nucleic acids, and those individuals who are taking cancer chemotherapy, we can see in that patients there will be an increased production of the uric acid. So now let's see in what all clinical conditions we can see the decreased excretion of uric acid. Due to usage of thiazide diuretics or loop diuretics, what happens is these diuretics gets secreted in the proximal convoluted tubule through the same transport system at which uric acid is also secreted in the proximal convoluted of the nephron. At the same time, what happens is where uric acid is also secreted into the tubule and gets excreted out. Now when we give a loop diuretics, they get secreted instead of uric acid at the level of proximal convoluted tubule in the nephron, and thereby uric acid levels increases in the kidney due to the decreased secretion of uric acid. So here we can see thiazide diuretics and loop diuretics, and the uric acid gets secreted into the same transporter system and they get secreted in the proximal convoluted tubule through the transporter system and they get excreted in the urine. The other drugs which will decrease the excretion of uric acid is we have anti-tubercular drug which is ethambutol, which will also decrease the excretion of the uric acid. So coming to the last one, which is clofebrate, which is an anti-hyperlipidemic drug which is used in the dyslipidemia, also decreases the excretion of the uric acid. So this is what the basic pathogenesis of the gout. And these crystals will get deposited in the joints and the individuals will have severe pain due to the deposition of the crystals within the joints. Okay. So the most common and the first affected joint is first metatarsophalangeal joint.